Just barely made it. All right. And this hair is a hot mess tonight. We are in hot mess mama 4 mode. All right, guys. For those of you who are here, welcome. Those of you who are watching the replay, thank you for doing so. If you wouldn't mind doing so, put replay into the comments section. I do like to go back and see who was watching the replay and also answer any questions that they may have. I know we've got a few folks tonight that are coming in new, so they may or may not be able to make it live. So in case they're here for the replay, so they know what to do. Okay, we are now officially live on Instagram. Woohoo! Let's get this party started. All right, guys, you know the drill. Tell me who you are, where you're from, and what is in your drink. And we got Eric here from Tennessee. That's my Tennessee boy right there, coming in from YouTube with his Pepsi. So Eric, I'm going to send you the cheers. I got myself some nice decaf. I have become an espresso junkie, and like I love this stuff. All right. All right, we got Kim coming on board saying good evening from Indiana, drinking water but eating chocolate. Hey, no shame there. Loving that idea. All right, guys, I see some of you jumping on board this evening. Man, I am a hot mess tonight. Okay. All right, guys, don't be shy. Let me know who you are. All right, we got lots of questions that came in tonight, and I'm super excited about that. We got Gabriel coming in from Instagram. Buen verte, Gabriel. Muy bueno verte de nuevo. We've got Paola Wafa. Oh, Wafa, it's so nice to see you. We got Med Spa Dude. I like your name, Med Spa Dude. So Wafa is in Aruba. Aren't you fancy? Drinking her vodka and cranberry. Nice. All right, we got Steven Stridell on board. We got Scott. Scott, I got your questions, man. I got your book ready. You are going to be in good shape, man. He's got his Cold Sprite Zero in West Virginia. We got Benny Cortez. Hopefully you had a good time celebrating the Marine's birthday. Tatiana, and we got Andre. So Andre's here tonight. Got cast on Monday, get my first talking on Friday. Congrats, Andre. That's awesome. We got Dave on board from Rehoboth Beach. We got another David on board from Newberry, South Carolina, drinking his green tea. So we got a nice crew popping on board. I'm gonna try to be better. I'm always so bad about popping back and forth between the Instagram and the rest of the channel. So I really want to make sure I do it well tonight. We got Glenn and Miguel on board on the Instagram channel. Okay, we got Emily coming in from Central PA with her peppermint mocha. She's got, hands down, guys, she always has like the best drinks. We got Don from Canada with his coffee sip cream. Don is my total badass firefighter. So thanks for being here tonight, Don. We got Jackie coming in. Guys, we got Cuba tuning in. So this is awesome. Everybody say hi to Jackie. Saludos, Jackie. So she's coming in from Cuba watching the show. That is so cool. We've got Harsh on board as well. All right, guys, we got a nice crew going on. So we're going to do a little bit of Spanish here for our Cuban friends as well. So let's get this party started. Pastor Dave. Oh, it's a party now. Okay, so for those of you joining me for the first time, welcome. My name is Cosi Belloso. I'm a physical therapist here in Tampa, Florida. Been a PT for 23 years. And my passion is working with the amputee and limb loss community. Bienvenidos a todos que vienen aquí por primera vez. Mi nombre es Cosi Belloso. Soy una fisioterapeuta aquí en Tampa, Florida. Y me especializo, no puedo hablar hoy por la noche, en los amputados y el cuidado y la recuperación. Okay, so we got Mark S. Oh, game night, but you're still here. I am so honored, Mark. I'm so glad to have you here, man. All right, we got Christy coming in from Auburn, Nebraska. There we go. Let's jump in with this first question because this one, I don't know if this particular individual is on board tonight. We got Crows coming in, K-Rose coming in from Michigan, just some boring Diet Pepsi. Hey, no shame with Diet Pepsi. I love myself some Diet Coke too. All right, we got Sylvia coming in from Michigan and just water. That's all right. We got a lot of people. ¿Qué pasa, Martín? All right. So the first question, I actually picked up this question. I was tagged by someone in a Facebook group, which, by the way, guys, if you ever see, like, I belong to like 30 Facebook groups, and I wish I had more time to go through them and pick out and answer questions. But I love it when you guys tag me on a question that you feel like I can answer on a Facebook group. So please feel free to do so. Please feel free to do so. So this one I got tagged on. And I guess this particular young lady, she is a bilateral below the knee amputee. She was on her way out to run an errand. And thankfully she was with a friend. And she was wearing her check sockets, temporary sockets. And unfortunately, one of them cracked on her. And it sounds like from what she wrote in the post, she was able to prevent herself from falling. And the friend that was with her was able to run and grab a wheelchair and, you know, save her bacon at that moment. But, you know, obviously this was a very distressing situation. And she had a lot of questions like, what would I have done if I would have fallen down? Like, what gives? So first, I do want to say a couple of comments about check sockets. And let me see if I think I have one in here. Here we go. So when you have a socket made, when your prosthetist is making your socket for the first time, they'll make what's called a check socket, a temp socket. It's basically kind of like this. It's just made out of a clear material. Some of them are 3D printed. Some of them are made out of other thermoplastic materials, right? So the whole point of the check socket is exactly that. It's just to check the fit, to kind of do a rough draft before they do the final casting and put the fiberglass and all the fancy stuff on there. All right, this material is easier to work with. It's easier to kind of mold and make changes and do what have you to it. Now, the thing is, it's not going to be as strong as your final cast, as your final socket, excuse me. So, and this is a hot topic sometimes among clinicians. Some prosthetists will not allow their patients to take the check socket out of the clinic because they are concerned about liability with regards to the socket breaking. Other prosthetists feel very comfortable taking casting material, wrapping it and reinforcing the bottom half of the socket and allowing the patient to take it home. So some people would ask, well, why would a patient want to take home a socket that could potentially, is not the final socket? The reason being is a lot of times when you have a new socket, you don't know what kind of problems you're going to have until you start using it. So whenever I've had patients in the past who have check sockets, I usually talk to the prosthetist and see if we can bring it to the clinic for treatment so that we can kind of put it through its tracks, I guess, and have the patient really use it and then pinpoint, okay, these are areas that need to be addressed and hot spots and pressure points and pain points and things like that, which, you don't really get that if you're just using the socket for, 15, 20 minutes and walking up and down the parallel bars. Okay. But again, it's, a lot of it depends on the comfort level of the prosthetist. I will say the majority of the prosthetists that I work with, they just do a really good job of reinforcing the bottom with like a fiberglass casting material because again, they want their patient, but it's with the caveat of saying, you gotta be careful. Like, you gotta be careful when you're out and walking around in them. And sometimes they do break. And guys, it's really nobody's fault. Like I'm not saying it, it's not the patient's fault because they're just trying to go through their steps and practice, and even the prosthetist, some of the best reinforced sockets, they'll crack, again, it's just something you need to be aware of. And if you are a bilateral amputee, then yeah, it's going to be a little bit more prone. You have to be even more careful because again, it's 2 check sockets holding your full body weight. Okay. So, that's one discussion. The other part of it is what happens when you fall. Okay. This is something that, I've just learned to tell my amputees and my wheelchair users, folks who use wheelchairs, spinal cord injury or amputee. At some point in your life as an amputee, you are going to fall. It's going to happen. And probably more times that you're going to have near misses. Hopefully you have more near misses than actual falls. But unfortunately, at some point in your life, you're going to have a fall. Okay, so the question is, what do you do? So when you're going to physical therapy treatment, this should be a skill that they should be teaching you. Okay, some PTs will go so far as to teach their patients how to fall, trying to do kind of almost like a ninja move, right? Judo ninja roll, right? And again, that's sometimes a little bit harder because sometimes when we're in the process of falling, we may not think to do it correctly, right? But getting up from the floor, that is definitely a skill that I teach my patients. And again, you have to sometimes as a patient advocate for this because sometimes there are physical therapists that are not comfortable doing this, or they may not think it's an important skill to learn, especially if they're not, if they haven't worked a lot with the amputee population. Okay. So when it comes to getting up from the floor, this is something that I think everybody does it just a little bit differently. Usually the way I do it in my clinic is I will just create a safe environment. So either I will, depending on the size of my patient and how strong they are, for my strongest patients, I can go ahead and just lower them down to the floor and start from there. And I usually have a second pair of hands available in case we need a little bit of a lift up in case the first few tries don't work. Okay. And I'll start by letting them use a chair. to lean on as they learn the mechanics of how they can get up. Okay. And again, there's so many different ways of doing it. The next thing that I do is if it's a patient who is perhaps not very strong, I like to put them on the treatment plinths, those really big treatment mats. So that way, if they're not able to get up on their own, at least they just have to scoot to the edge of the treatment mat and they can stand up from there. Okay. I have my patients try to do it with their prosthesis and without their prosthesis. It just depends on the person. A lot of times with my bilaterals, I really need to teach them. So I'll put like little graded steps so that they lift themselves up onto the next set of steps until they're all the way up into their chair again. And we start by working on it that way. There are a lot of great videos on YouTube, guys, of amputees demonstrating how to get up and down off the floor. Now, again, because I'm a clinician, I have to say you need to practice this in a safe environment. And ideally, you need to do it with clinicians, PTs, who are helping you out with this. But I am practical minded. And I think if you take responsibility for yourself and you use common sense and make sure that you're in a safe place and with people who can safely help you. Okay, so next thing I recommend is once you learn the skill of getting up off the floor, you next need to learn the skill of being bossy. And I know this sounds really weird, but those of you who have had falls in public, guys, cozy poll. How many of you have like wiped out in public? Like just like taking a full, just fall in public. Go ahead, throw it up into the comment section. I want to see while I take a sip of my coffee. I want to know who's completely wiped out in public. Okay. And then the next question is, what's the first thing that happens when you fall in public? Everybody around you wigs out, right? For whatever reason, right? When an amputee falls in public, and this is because my patients have told me and also because I've just observed it, everybody wigs out. Right. And, thankfully, for the most part, people want to jump in and help. Okay. That can be a good thing, but that can also not be such a great thing. So once you learn the skill of getting up off the floor, you need to learn how to advocate and to be firm when it happens. Right. And the first thing you can say is if you do need help, that you direct people. Okay. Because obviously everybody just wants to start pulling and tugging and helping you get off the floor. Right. So it's okay to be assertive and say, guys, just stop a minute. I will tell you how to help me, but let me tell you how to help me so that nobody gets hurt. And then give instructions, give people something to do. Yes, please bring me a chair. Yes, please. Can you get my legs? It's sitting over there and I'm going to need it to get up. Right. Or yes, put your hand here. And I'll, when I say so, give me a boost up. Okay. So that's another part of the learning how to get up off the floor that, I try to teach my patients and helping them. All right, let me read some of these comments because I know when I put that question out there, I was going to get some good comments there. Okay, ¿Qué pasa, Martín? All right, we got Jerry Ann here from Arizona with cinnamon roll vanilla coffee. Oh, that sounds so good. I love coffee, guys. I am a coffee junkie. Martin's here with a bruised stump, and I think I got your question here, Martin. I had somebody ask, oh, that was you who sent that question. Okay, now, good, awesome. We got Dan coming in from Kansas City. Mark says his prosthetist wouldn't let him take home the check socket. Yeah, some prosthetists don't like to do that. Christy, apparently same thing. Marvin, cuando vienes a Guatemala, mire, ya yo estuve en Guatemala el verano pasado. So, si tú encuentras un vuelo barato para mí, yo me voy para allá. All right, Emily says, I never took home my tool. A lot of you didn't take home your check socket. Scott says, I destroyed one in a few steps, but I'm a large guy. Now we just stand up and walk in place for a test, right? Benny says, when I got my first check socket, I took it home and I went out and played softball. I am not surprised at all, Benny. Rick says, use duct tape. I agree. I think duct tape is amazing. I've actually used duct tape. Don't recommend it. Like, this is one of those like cozy moments. But we used duct tape when I was doing my, when we were doing our shooting the book and the video series. This lovely lady, she flew into town to do the video shoot, and we had 2 days to shoot over 150 videos, and she had a split in the flexible inner lining of her socket, and it was just, oh my gosh. So we ended up duct taping it. We're just like, we're going to duct tape this puppy and make it work. Don says, I cracked mine up the front and used a large pipe clamps to wear it back to the prosthetist who made me new reinforced with more fiberglass. And it was my third set before my final Kevlar socket's done. You sound like the kind of guy who needs a Kevlar socket. Oh my gosh, this is awesome. Eric says, yep, fallen a lot of times. Mark's fallen. Dave says, my OI axer breaks away in the fall to protect me and needs a reset. Upper body strength help. Yep, and especially some of you who have the Oprah system. Those of you who have the Oprah system for osseointegration, you can reset it yourself if the safety mechanism releases. Those of you who have press fit, you need to go back to the prosthetist to get it reset. So Susan says more than once. Susan girl, yeah, I was with you during one of those times, and you see this gray hair right here? That's from that time that you and I had that little incident at Amputee Coalition. Yeah. So we got Martin says, yep, three phone times right now. It was in my back in the parking lot. Ouch. Ashley says, she's fallen too. Strings in my Revo broke in the wall. Oh my gosh. Jamar's fallen in public. Y'all, yeah. And Eric says, some people want to help. And Mark fell in Publix. Zelam says, I fell right in front of a restaurant because I didn't place my foot squarely on a flat rock. Oh, my ankle twisted, causing me to fall on a cold day, and it took me a while to get over the shock. Yeah. Ashley has fallen at school. Oh, my gosh. Yeah. Like, y'all got some stories about falls. Let's see what Instagram has to say. K Rose has fallen more than once. Paola has also a big problem when I lived in Minnesota. Yeah, y'all who live in the ice and the snow and the sleet, God bless you. Hey, Dick Devers, glad to see you on board. All right, and so David says pin lock failed on a boat dock and fell on a pin and bent at 90 degrees. Holy mackerel, how do people do this? No crutches, walker, wheelchair in the truck. Ouch. Okay, yeah. And again, if you have the ability to kind of just prep ahead of time, that's actually, David, you kind of bring up a good point, is that if you are somebody who's driving yourself in public and you have, you are independent with your transportation, it's probably not a bad idea to keep crutches or walker in your trunk just in case. That's actually a pretty good idea. We're gonna have to put that on the list right there. Kim says 3 weeks ago she fell and broke wrist. Oh, and 2 guys picked me up. Oh, it's just, and guys, it kind of like, it's one of those things where, I spend so much time in the clinic trying to help people get over their fear of falling, because yeah, it's a real fear. And then at the end I teach them, okay, at some point you're going to fall. And it's just like, trying to teach them that skill. Okay. Next question. Sylvia says, I go in Friday to get measured and casted for my first prosthetics. I'm a bilateral below the knee amputee and wonder what I should be asking at my first setup. What is offered for my prosthetics? Are there different types of prosthetics that a first timer should use? And do you have an episode that goes over this stuff? I know insurance can limit our choices, but I don't want to go in blind. Okay, so yeah, a couple things I'm gonna toss your way. One of them is on my website, and this is not just a shameless plug. Okay, if you go on my website, I have a podcast and a blog link. Okay, and in the podcast and blog, I have 2 episodes, articles, whatever you want to call them, dedicated to everything you need to know about prosthetic feet and how to go about choosing a prosthetic foot. So there's a lot of really good information there that can help you have that conversation with your prosthetist and help you ask the right questions. Okay. So that's the first thing there. The first time those first visit or 2, when you go see the prosthetist, you really need to give them a lot of information about yourself and what it is you want to be able to do. Give them a picture of who you are, okay? They're seeing you for the first time. They didn't know you before you lost your legs, okay? And who you were before is also going to help determine where you're going to be headed after your amputation. If you were somebody who was very active, you were doing a lot of sports before your amputation, then there's a good chance it's something that you're going to want to get back to doing. And hopefully you're able to keep up and start with a little bit more of an active foot. If you're somebody who was not very active and perhaps you were more sedentary because of what was leading up to your amputation, a lot of my vascular patients, they lose a lot of their mobility, right? And it's good for the prosthetist to know this because it helps them understand that you might need more stability in your prosthetic components. Okay. But you need to advocate for yourself in this regard. And again, same thing with the physical therapist. When you go see that PT, you need to tell them these are the goals I want to accomplish, however far-fetched they might seem to you, okay, or however crazy they might be, okay? Your job is to let your clinicians know what it is that you want to do, and it's your clinician's job to either A, figure out a solution to help you get there, Or if some of these goals are maybe not within your reach at the moment, help you understand what are the goals that you can reach and help you get there as well. Yeah. Okay. And then again, there's a lot of value in the amputee community in the sense of there's so much that you can learn. Okay. And, I talk about the Facebook groups. I like to think that this show is another good resource. But talking to other amputees, right? They've been there, done that, gotten the t-shirts. They got some great shirts too, right? So asking them, what was the process for you? How was your experience with your prosthetist? How was your experience with your physical therapist? Sometimes you might be getting some folks who are giving advice that they're not qualified to give, like medical advice. And sometimes that happens, and you see that on Facebook. But if you use your common sense and good judgment and just kind of piece out the good information and take the good advice and just hearing about other people's experiences, okay, can also be a huge help. Let's see. Xylem says, what if an amputee wants to use their temp socket while driving, and what if something happens while they're driving using the prosthetic leg with a temp socket? Yeah, that's something sticky to consider. And that's not just for temp sockets, that's also for definitive sockets. So when it comes to driving, okay, if you are a left leg amputee, you really don't have much to worry about unless you have a manual transmission. Okay. If you're a right leg amputee, then yeah, you got some work to do, in the sense that you need to go to your local DMV and you need to check what are your state laws regarding driving with a disability. I know there's a lot of driving programs, adaptive driving programs that are springing up just even since the past 7 years since I opened up my own clinic here in Tampa. Okay. There are actually some therapists that specialize in return to driving. I know in Florida, there's not many of them. In Florida, there's at least 2 or 3 of them. And usually it's a physical therapist or an occupational therapist that's what they dedicate themselves to, teaching people with amputations, teaching people with spinal cord injury, with traumatic brain injury, with stroke, how to return to driving safely. And they also help with making modifications to the car. Okay, so this is something that you need to take seriously, because God forbid you get into an accident. Is it because the prosthesis got in the way? Maybe not, but you want to have everything in place so that, kind of prepare for the worst kind of scenario. When it comes to a temp socket versus definitive socket, again, you just have to think about the strength of the socket. I mean, and this is something to ask your prosthetist. They're going to know how strong that socket is, right? So that's kind of something you got to kind of put that one back onto the prosthetist. But any driving in general, you really need to get it cleared, and you also need to give your insurance a call and just say, hey, this is what's going on right now. They might have recommendations as to where you can go for adaptive driving, but getting that done the right way. Silent said, I had a patient that drove using his prosthetic leg, and the leg came off while he was driving, and he ended up rear-ending another car. Yeah. I mean, I have heard of some amputees that are driving with their prosthesis. I know some of them, there's at least 2 that I know of that they have been amputees for over 40 years. So for most of their life. And they learned how to drive with their prosthetic leg. But in those cases, I would say it's because that's how they've always been. So that to me is a different scenario than someone who recently lost their leg and is starting to drive using the prosthetic leg. I can't say that I recommend it. I can't in good conscience recommend it. There's a lot of adaptive driving tools that can be done to modify the car. And that's something that is worth the investment. It's an investment in your safety, and it's also an investment in your independence. Okay, because if you can outfit your car to allow you to be independent, this is going to allow you to return to work. It's going to allow you to return to your life. And I really don't think it's worth taking shortcuts in that regard, because unfortunately, yeah, you can get into an accident and hurt yourself and someone else in the process. So yeah. Okay. Let me see. Cairo says, almost fell on a patient. Yeesh. Yeah. Hey, we got Johnny V on board. Oh, man. Good to see you, Johnny V. And we got Victor Deloach on board as well. And Scott coming in from the Instagram channel. And Doc Linda. We got a lot of more people on Instagram. I'm really excited about this. So guys, Instagram folks, if you want to start asking questions, please feel free to do so. Emily says, I've always driven with hand controls. Driving with a prosthesis sounds scary. And again, guys, you know, your ankle, your prosthetic ankle doesn't move. Like, it doesn't move on its own. There is a motorized ankle out there, but it's not meant to work in operating, you know, in operating the accelerator or a brake. So again, this is where I say everybody's a little different, but everybody needs to have adaptive driving. Especially if you're considering driving with your prosthesis. Really need to have that done the right way. Let's see, we got Glenn. Oh, what's going on, Glenn? Don says, I've been driving for 12 years with my right leg amputated and now bilateral bone. It was cleared by DMV and BC ambulance to drive lights and siren. So, but Don, you did it the right way. You got cleared by the appropriate folks. And I'm sure you had to go through some form of either supervision or testing or some sort of screening to make this happen, you know, and then that's, you know, that's how it should be done. So again, it's not something I specialize in. I did not, that's probably one of the few specialties I haven't dabbled in physical therapy is return to driving. You know, no, I can't do that. I have a hard enough time teaching my teenagers how to drive. I am not the best person for that, but I do think it needs to be something that you need to look into. Let's see, Van Gregory's coming in from Texas. I hear declaring you have an amputation on your driver's license, it reduces some liabilities with accidents. That is very interesting, Van Gregory. I have not heard about that. That is good to know. And again, reporting it to the DMV and reporting it to your insurance, I think, is the responsible thing to do. Hey, we got Denise coming in from North Carolina, and then Susan saying hi. Oh, Marshall's there saying hi too. All right, guys, let's check out some of these other questions. Jessica asks, hey, I like how she started that. She goes, hey, why do you think amputees present with trunk lateral lean on their involved side during stance phase? So this sounds like a therapist asking me this question. That or a really smart and savvy patient. Okay, so what is Jessica referring to? Let's see if Bob is willing to help out with this one. I don't know about Bob. Guys, if you haven't met Bob, he is my snarky and somewhat reluctant model here. Okay, so when someone's walking, and they put their prosthetic foot down on the ground, we call that being in stance, right? They're standing on the prosthetic foot. Unfortunately, it's kind of hard to demonstrate here, but so we're going to say that Bob is standing on his left right here, okay? So sometimes what will happen is people will lean over towards the prosthetic side, okay? Couple of different reasons that this could be happening. Number one, if the prosthesis is too short, they're going to have to lean over so that they can get this leg to swing through. Number two, if those of you who are above the knee amputees, if that socket is digging up into your groin, a lot of times you'll lean toward the side of the prosthesis to kind of relieve the pressure that's going on right there. Likewise, for my above the knee amputees, if you're feeling a lot of pressure on that bottom outside part and your bone is just clacking against there, some people will kind of lean to get away from that pain or discomfort. So a lot of times when I see people doing all sorts of funky leans, I just think, what are they trying to get away from? It's like they're trying to get away from a discomfort or a pain. And the other side of it, and this is also a huge part of it, is weakness of the glutes, specifically the glute medius, right? So the glute medius sits underneath your gluteus maximus, your booty, your bum, your bahucus, your tuchus, your tushy. We could go on and on for all the different synonyms for behind, right? So basically, when you have a weakness in the glute medius, okay, your body is not able to keep your pelvis stable, okay, while you're walking. So it's going to do all sorts of funky things to try to stabilize that pelvis, okay. The good news is it's a fairly simple thing to fix, okay. With glute medius weakness, you guys probably know that my favorite exercise is doing bridges. And you can find that in my exercise program if you haven't already subscribed. Here, I'm going to put it up here. Hang on. I can't talk and I can't type tonight. Here we go. Bam. Okay. So if you go there, guys, I have over 150 exercise videos for above the knee and below the knee amputees. I have books. Where do I have books? Here I have books. I have a book for above the knee and below the knee amputees. Lots of exercises, head to toe, beginner to high-end athlete, all in here. Okay. So basically when it comes to fixing that lateral trunk lean, Okay, when you're leaning over to the side, find the root cause. And this is something I tell my younger therapists and my novice PTs, as well as my amputees. You got to find out what is causing the problem. And I know that sounds like master of the obvious, but it can get a little bit tricky, right? Sometimes the problem is coming from the person, meaning they have a weakness or a tightness or something cooking. Other times it's coming from the prosthesis, right? A lot of times it's from both, right? And something that perhaps is being caused by the prosthesis is going to cause the person to do something funky and different, right? So you got to kind of piece out where things are coming from. And when you address the root cause, that's when you can get some really nice results, okay? So again, a lot of times leaning over to the prosthetic side, glute weakness, you got to solve it by strengthening those glutes. So you got to use it or lose it. And then also looking at the prosthetic fit. If you're just like kind of uncomfortable, and a lot of times it's interesting, a lot of times people will just get used to the discomfort, right? And they just start walking in this funny way. And you ask them, you know, why are you walking like this? I don't know. Well, does your socket bother you? Yeah, I guess it's kind of bothering me here. Okay, well, how long has that been going on? I don't know. It's been going on for a while. I just kind of dealt with it, right? So one of those things to kind of think about. Hey, we've got Reggie coming in from Bangkok. Oh my gosh. Reggie, man. Oh yeah, Reggie, I don't know if you know this yet, but you and I are doing a show in December. Have a good time vacation. We're going to get you back. Guys, I'm putting Reggie on the spot right now. So he doesn't know this yet because we've been plotting, the College Park team and I have been plotting when he's away on vacation in Thailand. Man, I hope you were having a phenomenal time, Reggie. You deserve to have a good, nice, long break. Thursday morning breakfast. Oh, that's so fun. Okay, very cool. All right, Reggie and I are going to talk soon. Glenn says, buy the book. It's an amazing resource. You heard the man. Buy the book. It's a great resource. All right. Eric says, mastering the lift with the chair, you know. Oh, yeah. So Eric, these guys have all been victims of asking me how to strengthen glutes, and I've put them through the gauntlet with it. Let's see. All right. Where was I? Ooh, there was another great question here that was going to segue. The question by Eric. Eric asked, how can gait training help with back pain or SI joint pain, sacroiliac pain? Hang on, let me check Instagram because I told him I would. We got RoboCop leg going on. Johnny V, thanks for following me. I appreciate that, guys. And guys, if you're on Instagram, hit follow. I'd really appreciate that very much. We got Victor DeLoach on board as well. We got the Duke. Ooh, I like that name, Duke. Sounds really cool. Okay, so Eric is asking, how can gait training help with back pain? Okay, so guys, it kind of piggybacks on this last question that I did of when you're having a gait deviation, excuse me. And the gait deviation is just a fancy word for saying walking with a limp, right? And there's literally dozens of possible gait deviations that an amputee can exhibit. I recently gave a course in Poland, and it was amazing, amazing course. By the way, you guys like my shirt? I got it in Poland. Isn't it cool? It's like they're like eagle. It's like really cool. Okay, so when I was giving this course, you know, we talked a lot and we spent a lot of time talking about gait deviations. And literally, I made a chart that was 7 pages long. No, guess 7 pages. It was 12 pages long. It was a 12-page long document chart on the different gait deviations an amputee can exhibit. Okay, and if it comes from the prosthesis versus if it's coming from the patient themselves, right? So why am I talking so much about gait deviations and back pain? Okay, here's why. Because when you start walking differently and you deviate from a normal gait cycle, your body starts to compensate, okay? Your brain needs to keep your body upright. So anytime you do any kind of a gait deviation that makes your head lean to a side or forward or anything but upright, your brain is going to make you correct yourself until your face is upright. Okay, that's the whole goal of your brain, is keeping you upright. So if you're doing something funky with your leg, right, your brain is going to adjust everything else to keep this upright. And it can cause some really funky gait patterns, all right? And then it could be one gait pattern leads into another deviation, which leads to another. So again, tracing everything back to the root, okay, is the most important. So how does that relate to back pain? Because inevitably, almost all gait deviations will cause back pain. Like that's just my blanket statement. And I know a lot of PTs are going to be like, "Oh, really, Cosi? You really all?" And I was like, "Yeah," because the majority of my amputees that come to see me in my clinic are usually months to years out of their amputation. Okay. In the beginning of my career, I saw a lot of people from the first 6-week mark, but now I'm seeing patients that are months to years out of their amputation. And one of their biggest complaints is, I have back pain. I have back pain. Okay. And it's from months or years of walking with a funky gait deviation. Okay. Now, I am not a back pain specialist. I'm not. I have colleagues who could run circles around me in treating back pain in the able-bodied population. But when it comes to the amputee population, yeah, because a lot of it comes from those gait deviations. So the first thing I start doing is I start looking at what is going on with the gait pattern. What is going on with the gait pattern? And starting to suss out, is this weakness on the patient's part? Is there tightness somewhere that's preventing them from having a full range of motion so that they can move the way they're supposed to be able to move? What is going on? Okay. And it can come from a myriad of problems. Now, sometimes it does come down to the skeleton. Sometimes there is a misalignment of the skeleton and that needs to kind of get put back into place. Okay. And as physical therapists, we've got lots of tools and resources and treatment strategies to address this. Okay. But for the most part, and again, I have no fancy research studies for this, none. This is just 23 years of practice. Okay. If someone comes to me with back pain, I can get rid of at least 70 to 80% of that back pain just by correcting their gait, pattern. Okay. And then usually what I will do, because again, it's just me, myself, and I, I'm a very small practice. So what I'll do is I will correct the gait deviations as best as we can. Okay. And then I will send them and refer them to one of my colleagues who is a back pain specialist, and they'll do a really nice comprehensive back pain program. Okay. And again, even if you don't live in the Tampa Bay area, this is something that you can do, guys. So if you are having back pain, let's just do a quick poll. I like doing my polls. I like hearing from you guys. Okay. How many of you have back pain? I'll wait. Jerry Ann says, I have the book and I use it almost every day and I love it. Thank you, Jerry Ann. That makes my heart smile to hear that. Hey, Carol. Oh, guys, Carol is one of the coolest people you will ever meet. If you ever go to a conference, go find the Integrum booth because Carol might be there and she is just one of the coolest people I know. We got the whole OI crew here today, Glenn and Susan as well. All right, so Glenn's like, yep, I got back pain. Eric says, yep, I got back pain. Eric, I'm going to be coming over to Tennessee next year, so you and I are going to have to work on that a little bit. Right? Let's see what's going on around Instagram. Okay. So Cairo says daily with back pain. Scott's got back pain. David's got back pain. Don's got back pain. Okay. So again, guys, this is where I would encourage you, if you have a physical therapist, okay, go and see them. And again, a lot of times the back pain can creep up on you because you have a gait deviation that you may not have picked up on. Okay. And let's say you've been to the physical therapist, you guys are working hard on your gait and you've corrected your gait as much as is possible. We're never going to have perfect gait pattern, but you've corrected it as much as possible. And the next step for you to do is, again, go see a back pain specialist. I've seen them work wonders. I've seen people who were knocking on the door of their neurosurgeon getting ready to have this massive back surgery. They decided to give physical therapy a try with a back pain specialist and they avoided surgery and they are living pain-free or almost pain-free. Okay. So again, this is something where I'm just like, go seek out this help. Kim says triple scoliosis, chiropractic massage therapy really helps. Scoliosis is obviously a little bit trickier. And again, there are specialists, there's not as many, right? But there are specialists in scoliosis. Don says 13 months in a wheelchair. Yeah. Oh yeah, that'll cause back pain right there. And it's interesting. Sometimes I will have some folks, and usually it's a bilateral above the knee, that they decide to choose the wheelchair as their primary source of mobility, or they're in a wheelchair because they have issues going on with their residual limb, with wounds, whatever, and they're having to use the wheelchair. So doing core strengthening and even glute strengthening while you're in the wheelchair is something that has to be addressed. And a lot of people are like, really? You got to be in shape to be in a wheelchair? Yes, you have to be in shape to be in a wheelchair. Okay. And those of you who don't believe me, just sit and slouch for 5-6 hours at a time and tell me you're not going to have back pain from that. Okay. And again, it starts from the bottom, starting from the glute strengthening and working your way up with core strengthening and then shoulders, arms, and everything else. So yeah, that'll do it. Oh, there we go. Dawn, that was the question that you sent in for me as well. Dawn had asked, after 12 months in a wheelchair, 13 months in a wheelchair, my back is in so much discomfort. I have to stretch my back backwards, leaning forward against a wall with my arms and pushing my hips forward every 15 to 20 minutes. Okay, and Dawn, especially for you, you're a bilateral amputee, right? So, you know, you got a little more skin in the game in this regard with regards to gait deviations. And with the work, the line of work you're in, you're a very, very active man. Okay, so having a strong core, like rock solid, strong core, that is going to be your game changer in your life as a bilateral below the knee amputee. Okay, and again, this is where wherever you live, I know you're in up north in Canada, you know, find yourself a back pain specialist. Okay. And again, I tell my patients, I have, like, for me, guys, personally, I have two PTs that put me back together again, depending on what kind of injury I have. Okay. So they are two PTs with two very different specialties. Okay. So in your case, Dawn, I would say, yeah, go find someone who's a back pain specialist, physical therapist. Okay. And that can help you with that. Yeah. Okay. I'm like losing all my stuff here. Okay. Duke asks, any advice on stretching the femur bone, getting it back to the right position? Just had OI on the femur. Okay, so Duke, a lot of it depends on the osseointegration that you've had and where you are in the procedures. You know, if you have a two-step procedure versus a one-step procedure, if you have the Oprah system versus the press fit, they will have very different rehab protocols. Okay, unfortunately, I cannot give you any advice because, again, this is a very specific procedure, and depending on where you are in the recovery process. Now, if you had osseointegration done here in the United States, you should be getting a comprehensive rehab program. Okay, and this is something, guys, I've talked a lot about osseointegration on the show, a lot, and I'm going to continue to talk a lot about osseointegration because we are seeing a lot more of it in the United States. Okay, and it is a phenomenal procedure. Okay, phenomenal procedure, but it does require very intense rehabilitation and very highly specialized clinicians to treat. Okay, so when it comes to stretching and strengthening, it's a very precise protocol that needs to be followed. Okay, there's a lot you can do, right? And you see some truly amazing outcomes and results from this procedure, but it needs to be done right, and it needs to be done with the clinicians that are trained. So Duke, I'm sorry that I cannot give you something more specific, but again, I would highly, highly advise you to make sure you go back to your team, okay? And ask them specifically, depending on where you are in the protocol, so that they can help you with whatever stretching you might need. Let's see, Reggie's like, he says, Cosi's telling the truth about needing a strong core. You'll combat pain, combat back pain. Yes, and Reggie can talk from a lot. Reggie, how many years now? Is it 40 or 50 years that you've been a bilateral below the knee amputee? So don't listen to me, listen to him. He's been there, done that. Francis asks, what do you think about the SCS system by Abbott? I have my generator with leads to my T9 to help with pain. SCS system, can you like tell me what that is? I don't recognize just the initials. Yeah, please let me know what you mean by the SCS, please. Carmen says, do you think prone position is helpful for both acute and long-term hip flexor stretching? Yes and no. So here's the thing, Carmen. When it comes to stretching hip flexors, it really just depends on the person. There are some people that they were like the first day out of their amputation, they're in the hospital bed and they just flipped right over for me and they were on their stomach and stretching it out. They were great. But there are some people that don't tolerate being on their belly or being prone when they're stretching. If you are, then yeah, that's a great way because you're kind of just allowing gravity to take effect. Okay. A lot of it also will depend on how tight you are. Okay. I have some people that are super, super, super tight. So if I were to put them on their belly, they would automatically arch up in response and compensation because of how tight they are. So that may not necessarily be the best position, right? Another position that you know what, let me look it up. I got it in here. I'll show you. Please hold. Okay. Those of you who have my book, it's like on page 110 for the above the knee. 109, sorry. So on page 110, you can see my amputee model, and she did have a little bit of hip flexor tightness, and she was able to obviously tolerate being on her back. But as you can see, when she's on her back here, she's not arching her lower back. So her hip flexors here are actually getting a true stretch, okay? So again, guys, this is where I'm always like, go see your physical therapist because they can really help you with this kind of thing, right? This is kind of what we do. This is another favorite way that I like to do hip flexor stretching, especially if you're not tolerating well being on your stomach. And it involves, let me see if I can point to the right thing. It involves putting your knee up. You know what, guys? I'm just going to show you. I think I can call it the video. Y'all want to see the video? Let's just do the video. I'm like trying to point in. I'm like, I have a video. Let me just do a video. Here's the video. Okay, so here's my above the knee, or here's my strong body program. And let's go to the flexibility section. And let's do this one. This is the one I want to see. Here we go.
So probably the number one culprit when it comes to being tight in a particular area for an amputee is the hip flexor area. That's the front part of your hip. You've got a lot of big, strong muscles here that help move your residual limb up and down, and they can get particularly tight. So there's two ways of stretching out this hip flexor muscle that I like to use. With this one, you can do this on your bed, and I'm going to have Robin scoot to the edge of the bed so that the residual limb is hanging off the edge. So you got to scoot over just a little bit more, and just be careful with this one, folks, okay? Now for this one, all you're going to do is you're going to let gravity take effect. So she's going to allow her residual limb to hang off the side of the bed. And as you can see, she does have a little bit of tightness. But this is a really great way just to kind of slowly let this stretch down and out. Sometimes folks like to keep their prosthesis on while they're doing this exercise because of the weight of the prosthesis can help bring down this particular side of the hip. You can also bring this knee up and bend your foot up just to take the stress off your back and also help with the balance. So with the stretching, I just recommend starting with 10 seconds, letting it hang for 10 seconds, and then bringing it back up onto the bed just to rest, and then bringing it back down. If your lower back is hurting during this exercise, you can put a little towel roll under your back, or you can also just adjust your foot to take the pressure off your back. Give it a try.
Okay, did that go through? Okay, so guys, I like to do that stretch. That's one that's a little bit easier for everybody else to do, and it can be just as effective as being on your belly. Sometimes if I'm feeling particularly nice for one of my patients, after a nice hard treatment, I'll give them a hot pack and put it right on top of their hip flexors, and it just kind of like melts the hip flexor down a little bit. Again, if you have a particularly tight hip flexor, you need to be careful because the muscle that makes it tight also attaches to part of your spine. So if you get too aggressive with stretching it, you can actually hurt your back. So again, this is where, it's the Goldilocks scenario, not too much, not too little. You want it to be just right. And something I say about flexibility, and I say it in the book, flexibility and stretching, it's exactly that. It's a stretch. It's not meant to be painful. It's not meant to be, seeing bug and eyes out. Okay. It's supposed to be a gentle stretch, and it takes time. Okay. It does take time to stretch some of these muscles out. Let's see. All right. All quiet on the Instagram front. Denise says, I had low back pain for months, found an amazing chiropractor who was not a quack and trying to rip people off. That's always good. He put together a treatment plan for me, but also noticed that with something with my gait. He spoke with my prosthetist, and between PT, prosthetist, chiro, I'm in great shape now. I let him look at the Strong Buddy book. He thinks it's awesome. Woohoo! All right, awesome. So you need your support team. And again, it is really a team approach. For me, I really advocate working with whatever prosthetist my patient is seeing, and especially massage therapists. I think they're wonderful too. to work together to solve some of these issues. All right, let's see. Let me get through another one of these questions. Okay, this question came in, and I think it came in through the texting service. And by the way, guys, let me just put this up here now for those of you who are new. If you would like to ask me a question, you can text me directly, okay? A lot of you have been messaging me through Facebook, my Facebook Messenger, and I do check it, but I don't check it as often, and I really feel bad when I see someone's message there that's been sitting there for 2 weeks. So the fastest way to get in touch with me is either through email, which I'm going to put up here now as well, or by texting me on this texting service. And then the extra bonus is I text you the links to the show when I go live. So if you have trouble finding me, that's sometimes an easier way. Martin asks a good question. How many people here that are amputated are on disability? Okay, I don't think we've ever asked that question. So let's ask that question now. If anybody would feel comfortable giving that information. How many people here are currently on disability? All right, so this other question is, I have how do you treat your stump if you fall on it? I recently landed on my stump, and this is the third time that's happened, and it threw a sore. This is the second question I've had like this in the past month, and another one of my viewers texted me 2 weeks ago with the same question, okay? So listen, guys, falls are going to happen. We already talked about that on the show earlier tonight, okay? If you fall right on your stump or your residual limb, again, I always recommend get it checked out. Get it checked out, because those falls can be pretty hard, and you are falling, especially if you fall right on the end of it, you're falling on bone, okay? And that bone is not meant to take weight bearing, okay? So it's going to be more sensitive than if you just fell on, like, I don't know, your knee or something like that with your other leg, okay? So get it checked out. Have someone lay eyes on it, whether it's your prosthetist, your physical therapist, or your doctor. Hopefully it won't be anything more than just a really nasty bruise. But what you want to do is make sure that no fractures. You don't want to cause any kind of trauma to the bone that could then lead to bone growth in the muscle. We call it heterotopic ossification. Some people, I've known that they've had some pretty nasty falls. They ended up actually dislodging the muscle. So the way the surgeon sutures the muscle together again in the amputation, and they've actually like ripped that off. And that can be a big problem there too. So I know it's a pain to have to like make a doctor's appointment and go in and see your doctor, but it really is something you should do, especially if you're having a sore on it and it's just, go get it checked out. That's something that somebody needs to lay eyes on it. Okay, so let's see. Denise says she's not on disability. Linda says she is. Eric says I am due to other issues as well as my amputation. Scott says I am for now, but goals for next year to be working. David is a left below the knee on disability. David retired the week that he lost his leg. Rolo says Earl is on disability in California. Kim is on Social Security disability. I do not work. I do a lot of volunteer work. So you're getting a lot of great input here, guys. Thank you very much for giving your input. And I'm also going to put in a little like plug for vocational rehab. So if there's some of you who would like to be able to return to work and think that you have the potential, look at the vocational rehab program in your state. I've learned a little bit more about this in the past couple of years, that apparently there are millions and millions of dollars that are allocated to state vocational rehab programs that are left on the table every year, unclaimed. And it's truly amazing what some of these rehab programs, these vocational rehab programs, they can provide car modifications, they can provide home modifications, they can provide training programs, schooling, pay for schooling. They can pay for physical therapy treatments. And in some cases, even pay for prosthetic componentry. If your ultimate goal is to go back to work, it's a fantastic resource and very underutilized. So there's my plug there for vocational rehab. Don says, I've taken too many bad falls, one with each leg after amputation. I don't move anywhere unless I have my prosthetic on. Yeah. Martin, I am No, Martin, not at all. I'm sorry to hear that. I really am. And I wish I knew more about the system with regards to disability. I truly, that's over my, above, what's the saying? Above my pay grade. That's the word I'm looking for. I'm sorry to hear that. Let's see. Oh, my pleasure. Oh, Tom. Hey, okay. Good to put that. Sorry, I have a hard time seeing now that I see the picture. I'm like, it's Tom. Yes. Let's see. K Rose asks, whenever I fall on my prosthetic, my residual muscles just cramp up so bad. Is that normal? Yeah, for sure. So, again, with your residual muscles, they're shorter than the normal length. So, and when you fall down, those residual muscles are going to try to contract very violently in an effort to prevent you from falling. And it's probably just a little too much stress for them. So they're going to be hot and bothered for sure after any kind of a fall. Yeah. Let's see. Sorry, I'm like going through these questions. Jerry asks, is there anything new coming out for prosthetics this coming year? Oh, yeah. Oh, yes. I can tell you one company is going to have a really hoopy scoopy new microprocessor foot coming out in 2025. We might be talking about that on the show next year. We've got another company that I think the Genium X3, I think just came out with the Genium X4, I think. I'm really, honestly, guys, when it comes to keeping up with prosthetic devices, I'm really, really terrible because there's so many that come out on the market. So if you have a particular question about a particular component, I can look it up and kind of give you my 2 cents on it. But when it comes to like there's dozens of new components that come out every year with all the companies that we have. So yeah, there's going to be a lot of stuff. Ben Gregory says, would we actually feel a vertical fracture if we had one? I've had a few falls directly onto the ends of my residuals, but I just take 1,200 milligrams a couple times a day for a few days in ice. And, my activity level, they seem to be okay, but should I get them checked anyways? Oh, Ben Gregory, grasshopper. The licensed responsible clinician in me says, yeah, you kind of should get them checked out. And again, the doctor might just look at you, do a physical exam and say, vaya con Dios, go on your way, you're doing fine. When it comes to fractures, no, not all fractures are going to be felt. I mean, you'll feel it at the time that you fall down, yeah. But if you have a hairline fracture, sometimes people don't feel those. So I will always tell people, especially if they're not my patient or if I can't physically lay eyes on them and put my hands on them and, examine them myself, then I have to be responsible and say, yeah, you should get it checked out just to be on the safe side. Trisha says, I love my vocational rehab rep. It's amazing. It's amazing what they can do. Okay. There was one more question here. How to get out of the dumps or depression when as an amputee things are not going as expected or planned and their frustrations that ensue on their own. So this is the topic that we do not shy away from on this show when it comes to mental health after amputation. And some of you who have been on the show long enough have heard my spiel on it. So again, I am not a psychologist. I am not a psychiatrist. I am speaking out of years of experience as a physical therapist where, yes, I do have to address the psychology of my patients. And I've worked in burn units, trauma units, spinal cord injury units, some of the, in units where you see human bodies go through some of the worst things that can happen to the human body. And seeing some really truly amazing recoveries, both physically and emotionally, and throughout the years, I've had the honor of working with a lot of patients like this. And I've also had the honor of working with two amazing psychologists, and I learned a lot from them. So, when it comes to healing from trauma, physical or emotional, I always start out by saying it's not normal. Right? Losing a limb is not normal. Going through cancer, and again, those of you who are joining for the first time, I am a breast cancer survivor myself. Going through cancer is not normal. Being a victim of burns is not normal. Having a stroke traumatic brain injury, the spinal cord injury, losing your ability to walk. That's not normal, right? And we are normal human beings having normal reactions to a very abnormal event, right? And that's something that I learned from one of my mentors, and it's a saying that has really stuck with me over the years, professionally and personally. Healing is a three-pronged approach. It's physical, emotional, and spiritual. And you have to address all three. Okay. When it comes to the physical therapy side of things, obviously our focus is a lot on the physical side. Okay. But as clinicians, we also have to address the emotional and spiritual well-being of our patients. Sometimes that can be as simple as screening our patients for depression, for anxiety, and making referrals. Okay. So when it comes to making referrals, I have a few favorites that I do have. The Amputee Coalition has a magnificent certified peer visitor program, and I recommend it all the time. Many of you have stated that until you became an amputee, you never knew an amputee, right? And talking to someone who's been there, done that is truly invaluable. Okay. I'm a clinician, and while I'm very experienced, I have not lost a limb, so I cannot relate to you as an amputee, right? That's a perspective that's very unique, and that you should have that kind of support. And I encourage my patients, whether it's in the form of a support group or an online support group, to find another amputee that you can talk to. Okay. And the other thing is, speaking out, finding, it takes a village, right? I know I'm kind of all over the place tonight. It takes a village. I know that what I find to be very helpful is when you have someone who's objective and who's outside of your personal circle that you can talk to. So whether that's a psychologist, a psychiatrist, a mental health counselor, a social worker, a member of the clergy. I have hair in my mouth. Comic relief, right? And there are a lot of members of the clergy that are very well trained in mental health and in counseling. Okay, that this is something that you need to find that person, and you may not necessarily need that person at that particular moment, but it's always good to have someone for when you do need them. And at some point in your life, at some point in your recovery process, you're going to need that person to talk to. Okay. So when it comes to getting out of the dumps, again, I don't have all the answers, and I am not a professional. Talking to someone about it, that's for sure. Another strategy I give my patients a lot is, looking at your progress long-term. If you look at your progress on a day-to-day basis, you may not necessarily see any improvements. So a lot of times when I'm working with my patients, it'll be a 2 steps forward, 1 step back scenario. And it can be very frustrating. Okay. And complications do happen, and that's a normal part, unfortunately, of the healing process. So it's a matter of saying, okay, let me look back a month from where I am now. Let me look back a year. Let me look back 2 years. Where am I now compared to where I was back then? And a lot of times a patient is usually pleasantly surprised when they compare how far they've come. And if you haven't come as far as you would like, think about the whys behind it. And I do it and say, have a come to Jesus talk with yourself. Is it something that you need to kind of find the right resources, right? And keep looking for those resources and find the right people who can help you. Is it advocating to your insurance company so that you can get the help that you need? Is it breaking out of your shell and going to one of the support groups and starting to form that community around you? There's a lot of things that you can do for yourself, even if your mobility is impaired at that moment for any particular reason. Okay. And ultimately it has to come from you. This is something that I've seen in my patients a lot, where I can give them all the support that I have available as a physical therapist, but ultimately it has to come from them. They have to want to get out of it, and they have to want to do whatever it is that they need to do to get those resources and use the resources. So again, I don't have the answers. I really don't. But hopefully if you're the person who sent me that question, if you're listening right now, that can hopefully light a little bit of a fire for you right there. All right. Dan says there's over 200 types of grief. That's a lot of grief. All right, guys. So with that being said, I think I actually got all my questions. So thank you, guys. If you haven't had the chance to do so, please consider either following me on Instagram or YouTube or Facebook. Got to get those numbers up so we can show those sponsors that we need to keep this resource alive and going in 2025. Coming up next in December, we're going to have a really great show with Reggie Showers. Like I said, he doesn't know it yet, but he's coming on the show. And we're going to be talking about some really cool stuff that College Park has going on. But next week, I will be here. It will be a general show. And I will be here. Yeah, I'm like, ooh, what am I doing next week? Okay, so next week it will be general Q&A. So please feel free to send me your questions to my email or through the text message. Kim says I attend the Zoom meetings online through Balance Amputees, and it really helps to have that connection. Yeah. All right, guys. So as always, thank you for letting me be a part of your lives this evening. I will see you next week. Same bat time.